level of health facility, the key things, like I was saying, is processing data, analysis, and presentation. Those are three things that are very important at the end of day of carrying out your data management. So, data processing is an act of transforming or changing or doing something on the raw data. Raw data are unprocessed information. So you change or you transform that raw data, which still have a lot of errors. Could either been having issues like spelling error, wrong information, wrong calculation, gaps in arrangement. So you have to transform them into a meaningful information that you can be able to use it for decision making. Until then, your information may still not be effective to be used in the management of patients' care. So we have the steps that you're supposed to consider or you're supposed to follow in your data processing, and that starts with data collection. Data collections where you gather data from primary sources like registers, tally sheets, and HMS tools, the like of maybe monthly reports, the surveys, and any other forms of, including medical records of patients. And when you're done with that collection, you go to step two, where you do data editing and cleaning. Data editing and cleaning is a process of checking for the completeness, consistency, and accuracy, correcting errors or what we are calling omissions. Omissions is an act of doing something and leaving others out, or eventually leaving things out. So this can either be unintentional action whereby when you're adding figures, you decide to leave others out, or you just forget to do that. So those are things that need to be found out and corrected. So data cleaning is very common for your data to be very consistent, be complete and accurate. Those errors has to be corrected. So step three, it has what we are calling data coding, whereby you have to assign numeric or symbolic codes to represent diseases or responses to various diseases. And that one take those one these are this particular stage are strictly understood by those one who are specializing in medical records. They do what they call disease classification and coding. Stage four, we do data entry, whereby we input data into electronic system. We can input data into Excel, district health information system too, or maybe the SparkTats software or electronic health record system that is used for managing a patient's records. So at the end of the day, you're supposed to feed the information into the system that is available. And number five is data tabulation. That term is coming from the word table, whereby you organize your data into tables for easy analysis. For example, numbers of malaria cases by district. You can actually arrange them on a table and have it easily presented. And then we have data analysis, whereby we apply statistical or logical techniques to summarize, compare, and interpret data. So this is maybe whereby we are supposed to convert information into a certain percentage or proportions. For easy understanding, is a comparison in terms of percentage, if we may say, etc. Are you having the same thing that I have? Of course, this is a different topic. So we have the next things to talk about, which is part of our subheading, which is analysis. So analysis, it is examining data to uncover trends or understanding patterns, how trends of disease are moving, relationships between two subjects, so that you can be able to make a decision that you understand about it quite well. So here we talked about different types of analysis. We have mainly four. We have descriptive analysis, which comes from the word describes, and that describes the categories of data that you have to analyze basing on the age of the patient, the percentage of immunization in children. So basically, when you want to really understand the coverage, you can describe to understand that we have the problem which is affecting mainly children under a certain age, or maybe the following percentage, the percentage representing the number of children that has been immunized within a particular area. So we can use descriptive analysis. And number two, we can use is comparative analysis, when you want to compare data across times, areas, or population groups. So in other words, we may say, let's see what happens between in the incidences of malaria between the year of 2024 and year 2025, so that we can be able to analyze and understand whether we are having an increases in the numbers of malaria cases when you look at what happened in the past year and what is happening in the current year. So such we can use is what we call comparative analysis. And then we have trend analysis. Trend analysis is used to observe the changes of data over time to predict the future patterns. We can actually understand that in a few years, we are going to have a high number of youth becoming smokers when we look at the lifestyles from now. So there we can determine the trend based on the time. The times we use is what we call seasons. So we can divide the year into two, or we can divide the month into 4 weekly. So we have like 4 weeks, and we can regard that as in the first week, second week, third week. So we can make a comparisons between those 4 weeks and see whether there is some changes, because you may realize that in the first week the numbers of certain cases are going up. The second week it drops. The third week and fourth week it again goes higher. So that can tell you something, because as the purpose of the data is basically to present the current incidences, and you can be able to use the same data to make a conclusive decision. It's not generally to really solve the problem, but it's to help you to make the best decision in order for you to deal with the current or the past problems. So eventually we have what we are calling inferential analysis. Inferential analysis are basically used in research, whereby we can take samples and we make a conclusive decision. We can target an area and of, let's say, 1,000 people, and then we pick 100 people. Let's say we want to confirm the incidences of HIV/AIDS within sex workers of a certain area. We can, in that case, we identify 1,000, and then we only conduct test or screening on 100. So the 100 will be representing the 1,000. Now, if out of 100 and the 100 of them turn to be positive, you comprise your data with 1,000. So the 100 represent the 1,000. So if you get 100% of the people, the sample you have taken showing positive, that means out of 1,000, in fact, in that case, it simply means that there is a possibility that the entire 1,000 left, all of them are positive. Because if 100 out of 1,000 is positive, that's 100%. So they simply mean representing that the entire population left, they're actually positive. But if you get only 10, it means those one who are left there out of 1,000 could be around 100 people, positive, representing 10 what? 10%. So we normally use this kind of analysis. Even what I'm explaining is real analysis, because analysis is about really observing and logically trying to identify with the comparisons, and you make your analysis with the conclusiveness. So we have data presentation. Data presentation here is a process of showing analyzed data in a clear, understandable, and visual format. So this is when you're really done with all the process of processing, analysis. Then you now make it in a way that people who were not with you during the processing and analysis can actually use your presentation to understand what is going on based on your analysis. So in this case, we use various methods depending on what we want to present. So for example, if we want to present sentence or maybe a statement, we can use what we call textual presentation. So in that case, we only describe data in words or in sentence, stating that in the last month of September, we recorded 10% of malaria cases in children between the age of 5 to 15, and that is okay. Someone can be able to understand that, okay, 15%, and in the previous month we have 20, so that means we have a drop in that case. So you can just write a paragraph that's enough to make a clear understanding, or you can use a table, what I'm calling a tabular presentation. You can present your data in rows and columns. Depending on the durations, what you want to use, maybe you're presenting your data for the entire year, for the month, for the week. So you use a table to do that. And then you can use graphical presentation, where you use visual aids to enhance understanding. This one is basically for improving, making it more clear or clearer to be understood. So we have some of the following tools. Bar charts. Bar charts, we use it when we are comparing quantities. Here we might be comparing numbers against the conditions. Malaria has affected how many people in the entire month, and we give that in terms of bar charts. Just like something like this. We can have this, and then you see this. So this column may be representing Monday, Tuesday, Wednesday, and something like that. So we know that on Monday was higher than Tuesday, and Wednesday was the biggest. So it is very easy for you to really understand what the description is. It's basically going on. So, the next things we have is bar charts. Bar charts are used for showing proportions. This is strictly for percentage. Line graphs for trends over time, when you compare trends against the time zone. And then histograms for frequency distribution, when you want to determine the speeds. This is normally used by public health, understanding the frequency of epidemiology or the frequency of disease spread. And then the maps can help us to design and give us a clear details in mapping of locations, areas that has been affected most. We can actually use that. So data presentation is very important because of the three following reasons. One of it is that it makes it easy for managers and policymakers to make effective decisions, and It also helps in communicating clearly to different groups of people that might not understand, but presentation make it very clear to them to really know what is being done and what is going on. And also it helps in improving in terms of improving health service delivery, because when we get to know by locations, by group age, individual that need services, then we shall be in a better position to really deliver to them effective services that they deserve. Now, we have what we are calling indicators that we use in public health. For someone who is doing like medical records, this is all about the indicators, you know. So here we try to understand what indicators is, of which I think I'll mention in several notes, especially if you had the first one. So I said that the health indicator is the measurable variable that reflects the health status of a population, the performance of the health system, or the provision of health services. So indicators is what tell us how is the status of the population. Are we having healthy populations, or we are having unhealthy population? What is the performance of the system? Is it poor, good, excellent, or there's some? All this is basically to understand whether we need corrections, we need improvements, or not. So indicators provide the evidence-based information that we can use for planning, monitoring, evaluating health programs as well. So because it is what tells us what is going on, you know. Just like that names implies indicator,